These are the instruments that will be used in this surgery. As you can see, compared to traditional knee arthroplasty, the instruments we use are much simpler and fewer in number. We typically place the primary instruments in this tray and set the auxiliary ones aside. This basic tool is a curette used for scraping cartilage. These are 3D printed models of the femur and tibia, made from the pre-op CT scans. They match the patient's anatomy exactly. On these models, we'll mark the attachment areas for these guides. This is the femoral osteotomy guide for bone resection, perfectly aligned with these areas. On this guide, there is a saw slot for bone resection on this side. These two nail holes determine the orientation of the femoral component rotation. This patient exhibited severe flexion contracture preoperatively. For such cases, we will prepare an additional femoral cutting guide with 2 mm increase of distal femur osteotomy. Before the surgery and after anesthesia, we repeatedly measure the degree of the patient's flexion contracture. If the contracture is severe, with a large angle and a long duration, we'll increase the thickness of the distal femoral cut to balance the flexion extension gap. This is the tibial side guide, which will be attached to the surface of the entire tibia. During placement of this guide on the medial side of the tibia, there may be instability or poor fit due to significant bone defects on the medial tibial plateau. We also have other tools, such as these 3D printed fragments, which simulate the shape of the bone segments to be resected according to the pre-op plan. These fragments are used for verification, calibration, and fine-tuning of the osteotomy procedure. They serve as a reference for intraoperative osteotomy, and are also used postoperatively for comparison with 3D printed bone fragments, allowing for fine-tuning and calibration. These printed bone segments include the distal femur, the posterior medial femoral condyle, the posterior lateral femoral condyle, the anterior femoral condyle, and the tibial side bone segments. Here's the next tool, a femoral model that was printed based on the preoperative plan after the femoral osteotomy. If the procedure is performed accurately, the femur shape after osteotomy should match this model. This model is first used at the start of the surgery to double-check the preoperative plan. Since the planning was done exhibited with images, there might be some visual distortions. However, this 3D printed model offers a tangible reference, making it easier to confirm the planning. We can use the CR femoral condyle matching this model in this case. A size 3.5 to verify that the planned femoral size, medial lateral width, and anterior-posterior dimensions are all appropriate. Additionally, this model can be used as a reference for checking and fine-tuning the osteotomy during the surgery. It also helps guide the placement of the femoral implant, ensuring it is positioned correctly in medial lateral direction. This tool is an alignment rod, used to assist the tibial guide positioning. Next, let's take a closer look at these tools. These are 3D models of the femur and tibia. The lines on the model indicate the osteotomy planes. These three areas are the attachments for the femoral cutting guide. One is located on the anterior cortex of the femur, while the other two are on the medial and lateral sides of the distal femur. A similar approach is taken on the tibial side. The model first allows us to visualize the entire pathological changes in the patient. Similar to the femoral side, the tibial side also has 3 attachments. These are located on the medial and lateral sides of the tibial plateau, as well as on the anterior tibial cortex. This is an auxiliary alignment rod for tibial osteotomy. This is a femoral model after the femoral osteotomy. These printed bone segments include the anterior femoral condyle, the distal femur, the posterior medial femoral condyle, the posterior lateral femoral condyle, and the tibial side bone segments.